Public health measures such as school closure, social distancing, and lockdowns were introduced by countries to control the spread of SARS-CoV-2 in the community. Our study modeled the effect of introducing and relaxing individual public health measures on SARS-CoV-2 transmission, indicated by reproduction number or R, using data from 131 countries. We found that school closure, workplace closure, bans on public events, requirements to stay at home, and limits on internal movement could individually reduce R by a range of 3 to 24%, 28 days after their introduction. And that reopening schools, lifting bans on public events, lifting bans on gatherings of more than 10 people, lifting requirements to stay at home, and lifting internal movement limits could individually increase R by a range of 11 to 25%, 28 days after their relaxations. However, the effect was not immediate. It took about 1 week following introduction and 2 to 3 weeks following relaxation to see a noticeable change in R. We further modeled 4 candidate public health measures to tackle a resurgence in COVID-19 cases. The first candidate, which included bans on public events and gathering of more than 10 people, could reduce R by 29% on the 28th day after introduction. The second candidate, which added workplace closure to the first candidate, could reduce R by 38% on the 28th day. The third candidate, which added internal movement limits to the second candidate, could reduce R by 42% on the 28th day. The fourth candidate, which added school closure and requirements to stay at home to the third candidate, could reduce R by 52% on the 28th day.